Welcome to Dental Vibes. I'm Gabby.
And I'm Carla.
And if you're new here, we have been dental assistants for over a decade now. In our channel, you can expect to see content for dental assistants, but also for anybody that likes to take care of their oral health.
And if you're returning back, thank you so much for your support. Don't forget to, as usual, like this video and subscribe to our channel. Of course, hit the notification button so you don't miss any of our weekly videos. And today, we're going to talk about the worst dental assistant program out there.
For you guys that have been following us for a little while, you know that Carla and I went to a full-time dental assisting program over 10 years ago, which was about a year long, including our externship.
Externship was probably like 3 months.
2 to 3 months, I don't remember exactly, but you know, it was long, every day, Monday to Thursday, and I think Friday was a half day, and then our externships were like
full-time everything, even class. So.
So nowadays, we have noticed that there are these programs that have been popular, which is the accelerated programs and the online programs. And we immediately can see a difference on like how
what kind of students, and what kind of students they're putting out.
And we're like, hold up a minute, like this is not okay. And we wanted to emphasize this: we are not lashing out at the students. No, please, if you've been to a program like that, don't take this personal. We are not blaming you, the student. The student does not know what they're getting themselves into. Sounded like a great program. They signed up. And you know that was that. We are calling out the actual programs. So we just want to make that clear. And we are willing to take the heat for this video because we know we're gonna make some people mad, and that's okay because we want to stay true to what we believe in.
And we know that there's many students that have actually thrived in these programs, people that are very independent, that they just great at their time management and they can go through a book by themselves. So it's worked for some people, but it's also not worked for many people. And it's the discrepancy is so big that we want to address these issues that have upset us so much. And again, we are not here saying that, hey, if you went to these programs, you're never going to be a good dental assistant, because that's not true. That's not true.
You know, maybe as soon as you graduated, you found a great office that was a mentor to you, and you picked up fast. And, you know, that does not mean that in the future you can be a great dental assistant. But we do have a lot of reasons why we hate these programs. So we had to share with you guys, especially for the new, just anybody that's interested in dental assistants, they're researching which program they should go to. Make sure you do your research and make sure that that program is going to be a great fit for you.
So let's just start. Let's get into it. Okay, so our first bullet point or reason why we don't like these programs are not enough classroom time. That is like essential, because to me, you can go through a book, like read something by yourself, but you still need that interaction with the mentor, you know, or the professor to kind of teach you things, right? There has to be somebody, somebody that's there like explaining things, because believe me, like with dental terminology and all the procedures, you're not going to understand or make sense of everything right away. So if you don't have somebody helping you walk through all of that, it's going to be really tough. Also, I think that you need somebody to, just like we say here, tell you like the real life situations. It would be ideal if your professor has had a lot of experience being a dental assistant themselves, because I think that's when you really can say, hey, this is how it really gets done in the real world.
Because on the book, sometimes is going to tell you the proper way. It doesn't always happen that way in the real world. So it's really important for your instructor to be like, hey, like obviously you need to know the proper way as like background knowledge, but this is what you're going to encounter. This is how you handle it if you have issues, have a troubleshoot. But also, you know, the programs, well, these accelerated programs that we've been seeing, they're like 12 weeks long. They're already short as it is. They're meeting like once a week. That's absolutely crazy. And, you know, the online ones, I mean, they're probably just having to do assignments on their own, which the same thing that you said is one thing if you're reading the book by yourself and trying to make sense of it, but it's another thing when you have somebody there that's walking you through everything that you're learning.
And if you think about it, look at how many videos we have put out there, and we're just like getting started. We're like,
it's like
so long. We haven't even gotten into like dental specialties. That's how much we have to tell you about. So I don't believe that these very short programs or super accelerated programs, you know, are doing enough. Now moving on to our second point is not enough hands-on learning.
This is what
kidding
irks me the most. Because, all right, every state is going to be different. So, for example, in Florida, we are certified to do sealants. We're certified to place top from iron bands. We're certified to do certain things. And these students are getting certifications for things that they never did. It's like, okay, you're certified to do a sealant, but you never did a sealant. Like, think about this, like, as a hygienist or as a dentist, like, you know, that you're working on people's mouth. Like, how are they going to be certified and have their license to do something, and they're going to be released to the real world to do it, but they never did it. Like, that's scary if you think about it.
It's very challenging to work on a real life patient. It's very nerve-wracking the first time. So if you're not getting that practice before you go out there in the real world, like, it's gonna be a shit show for you. And even for us in our program, you never really feel totally prepared. So the more you can do hands-on learning experience, the better.
I mean, I don't know how the online programs do, because they have no hands-on practice at all.
Even do that.
Because at least the accelerated ones, they do meet once a week. So like
they have like labs. One day they
but the online ones is like zero hands-on experience, and it's like you get your certification to take X-rays, but you never took an X-ray on a real person. Like, I just don't understand that.
That's tough. Alright, let's move on. Our third point is not enough externship requirements. That's another one. That's a big one. It goes along with like the hands-on learning experience. So you learn at school, you maybe practice on each other. In your case, I think you said you even saw other students in that college.
So for corona polishing, we did practice on each other, and then they're like, okay, well, you're gonna have like a schedule full the following day, and you're gonna see the medical assistant students. So you're gonna go ahead and take care of your schedule, make your appointments, and then you're gonna be seeing these patients for corona polishing. And then after that, we're gonna interview your patients and ask them how you did.
That's cool.
And that was even before I went to my externship.
And even just like practicing on your classmates, you know, they're gonna tell you the truth straight up.
Or like, you need to like work on this.
So you take that learning into your externship site. So you can't do just like one day. I mean, one day of externship is nothing. It goes like this, number one.
It's nothing.
And you gotta remember, the patients that you will see at your externship sites, they're paying patients, right? So the office, they can't just like let you know, you can't just like walk in and they're gonna let you just work on their patient like that, right? I mean, there are things that they have to look out. Every patient is different. It's their patient, so they don't want to give them a bad experience or give out a bad image of themselves. So you have to learn their trust. You have to learn their ways. I think it takes a solid like 1 to 3 days. And then if they feel comfortable with you and you know you're ready to jump in, then you know you have to do at least the 4th day and then another week. You know, like mine was a solid 3 months of externship, and we actually rotated. They try to give us an experience of like seeing different dental specialties. So it just needs time, and with that you build experience, you feel more comfortable. By the time you graduate, You go into an office, do an interview, do a proper working interview, and you just do better.
Yeah, you can like carry yourself and be like, okay,
yeah,
I can do this.
Yeah.
But as far as how long the externship should be, definitely not a day.
even a week, it's a little tight.
Even a week. So I talked to this one person that was about to graduate, and she said that her accelerated program was actually at a dental office.
Okay.
Like a dentist was running this program. So I was like, oh, well, since it was at a dental office, then
you have everything there.
Then they have more hands-on experience. She said, well, not really. My externship was like a day shadowing, and I'm like, what?
That's weird.
That's crazy.
That is crazy. I mean, they have everything. The dentist could have extra assistants.
Yeah, so it's just not enough. Like Carla said, even if you do have a long externship when you graduate, you're still gonna be learning. You're still gonna be nervous. You're still practicing. But if it's a day or even a week, you're probably not going to experience a lot, and you're probably not going to get to assist or do certain things that you should be practicing at your externship.
Yeah. So our fourth point is not enough guidance to succeed in dentistry. And we're going to divide this into two sections, because number one, they lack a little bit on helping you when you go out job searching, job hunting, whatever you want to say it. And the other one is not really being clear what all of your dental assistant duties will be once you graduate. So let's start with job hunting, because you have a lot of experience helping our new DAs getting their resumes done. Number one, that's what you say. You're like, that needs to shine.
It's very important because, okay, I'm gonna keep it real. Whenever an office is hired, unless they are super open to train people, which in our area that's not very common. They're gonna look at a resume and see that you're a new grad. They're gonna be already like,
we'll see.
We'll see, because they want somebody with experience.
Right.
Now, if you are a new grad in your resume, like you had 1 day of externship, they know you are like starting from zero. Right? Or like, even let's say you did have a week or two of externship, but you didn't actually practice anything yourself, you just shadowed. Like, you don't really have a lot of things to put down on your resume, so your resume really is like, for the dental section, is like this small. So it's just not a good look from the get-go. Your program should be guiding you on what your resume should be looking like, especially if you don't have a lot of experience to list there.
There's like key things that dental offices look for. Somebody should be telling you what those are, so you know, for your resume, for the interview, and for the working interview. Even
the wording, because like sometimes, like I said, I helped some people fix their resume, and some of the wording made zero sense. And it's because, they don't know what they don't know.
Right.
So if a doctor is reading your resume and it makes no sense, they're not going to want to hire you, because you look like you're not prepared.
So the other point that on this section is that they don't tell you exactly all of your dental assistant duties, what they're gonna be. Like, of course you have, you know what to do as a DA per state, or even some don't know, but we're gonna leave a link below so you can go check out what exactly dental assistants you find in your state. But also, like, what do you do on your downtime, right?
Maintenance.
The maintenance is a big one. Especially the dental office is always busy. There is always something to do. Lab work, calling patients, whatever, all of that. Because I think that shows a lot, especially during working interviews, that they see you kind of always staying busy. Like, if there's downtime, you definitely don't want to like relax too much and be on like a 10-minute coffee break, you know what I mean?
And a lot of students, if they're not guided, they don't know that you're supposed to be doing certain things. Honestly, I got an intern once that like had no idea that we have to do sealants. Like, he was almost looking at me like he didn't even know what a sealant was. And I'm like, well, but you're in your externship, like your program needed to go over with you that, one, this is your duty. Like, you should be able to perform this by yourself.
Yeah.
And he just looking at me like he had no idea what I was talking about.
Yeah. Overall, summarizing this video, there is like the #1 thing we hate the most. And you want to go off right now? You want me to hold you back?
Yeah, I'm going to try to be nice as I deliver this message.
Yeah.
No, but honestly, I think that some states, you don't have to be certified. So there's still training on the job happening.
Yeah.
Do I think that some training is better than none? Some knowledge is better than none? Absolutely.
Yes.
Now, they are not honest with their students. If they were like, okay, this is the shorter, cheaper way to go.
Yeah.
You need to be aware that this is an intro to dental assistant. You're gonna have to work on your own to hustle and like learn these things on your own. You're gonna have to find an office that is willing to train you because you still will need a lot of training.
Right.
Then I'm okay with that.
Yeah.
But they're not honest. They're just like, hey guys, sign up for this 10-week course and in 10 Saturdays you're gonna become a great dental assistant and start a new career. And that's just unrealistic.
Because you'll get into the real world and you'll just be like knocked down because they're not going to give you an opportunity or
it's going to take a long time for you to find an office to give you an opportunity.
Right. So I think that if the students or their prospect students were more aware of like, okay,
what they were signing
what's
up for,
going to be their reality, what's going to, after graduation, what does that look like after, then I think less students would be less satisfied and less unhappy with being a dental assistant.
And we can at least say, all right, you know, I can respect that program because they're honest. It's just an intro. Like I said, some states you don't even have to go to school. So I believe that yes, some education is better than nothing. But I just don't like the dream that they're selling that's not realistic. And students don't know.
Yeah. If you're coming from zero, you don't know any better.
They're like, oh, this program sounds great. It's not that expensive. I'm gonna start a new career, and they just don't know what they're getting themselves into.
I think it works best for the dental assistants that have been trained on the job, and maybe they either are like, okay, I want to be full-time dental assistant working in the back, but I need the certifications, or the states are catching on that it's like, hey, we're gonna start requiring certain certifications, and so they have to take a program. Okay, you've been in the field already, you know what you need to learn, you know everything already, have a lot of background information. Then, you know, a quick 10-week program, online program, anything like that will help you because it's just really to get you to that certification.
And I want to touch bases on this again. I want to make sure that students that did go to this program or these kind of programs, or if you just signed up, we are not blaming you. Okay, and again, every office is going to be different. Some offices will have a really old school dentist that just wants an assistant to, you know, suction, handle instruments, flip rooms. And then maybe little by little you start practicing this, practicing that. So they are more lenient and they're not expecting too much out of you. So probably you will have no trouble finding that kind of office after a program like this. But if you are looking for an office that's, you know, high tech, fast paced, and that you're gonna be able to do all these things
and get better pay,
then you know you have to be realistic with yourself and say, listen, I don't have a lot to offer for an office as a new grad, so I need to like
start from the bottom,
and get your practice in until you can become that dental assistant. And hang in there. It's gonna take a while, but it's not impossible. So again, we're not saying if you've been to those programs that you're never gonna be a great assistant. That depends on you. You write your own destiny. But we are here to tell you that it's gonna be bumpy.
So with that said, if you have any further questions about any of the dental programs that you're looking into, go ahead and reach us out on Instagram, DM us. You can also leave us a comment below. If you also need assistance, just fixing up your resume, or, well, by the way, for the working interview and the interview, we already have the videos for that. We're gonna link them below, so check them out. And of course, like this video,
subscribe to our channel. Oh, I was gonna say, go ahead and leave us a comment if you maybe had a different experience that we talked about in this video. Maybe
people are thriving.
Yeah, maybe your program was great. So please share your story with us.
And we will see you next time.
Keep smiling.